Welcome to the A New Insight podcast, empowering and inspiring your journey to optimal health. Hosted by Dr. Supatra Tovar, clinical psychologist, registered dietitian, fitness expert, and author of Deprogram Diet Culture. Rethink your relationship with food, heal your mind, and live a diet-free life. I follow my guests' journey to optimal health, providing you with the keys to unlock your own wellness path. Tune in and evolve with us. Welcome back. We are back for the second half of our interview with men's health specialist, Dr. Kian Asanad. Dr. Kian gave us some really amazing insight into his inspiration to become quite the specialist in male infertility. And he is really on the edge of these incredible new discoveries and treatments. I can't wait to pick his brain some more. Dr. Kian, welcome back.
Thank you.
So, when a couple is having difficulty conceiving, what role should the male partner play? We always hear about, if a woman is over the age of 40, it's going to be very difficult for her to conceive and blah, 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 blah. But we don't hear as much about the male. Why are men often overlooked in this equation?
Yeah, it's a really good point. So we know that when women are born, they're born with a certain number of eggs, and that's all they get, right? And we know women over the age of 35, the egg quality and quantity decreases. It's not the same for men. Men are making, for the majority of the time, fresh new sperm every day. You see a 75-year-old in a wheelchair coming down the hallway, he's making fresh new sperm every day, right? And so we tend to think of infertility as a female factor issue, but that's also really not the case. 20% of the time, it is solely due to a male factor, actually. And I really try to educate folks in my community, my patients, that it's not anybody's fault. There is just roles that men and women play in achieving a pregnancy, right? And so 20% of the time, solely due to a male factor. Men can contribute to infertility up to 30% of the time. So overall, 50% of the time, men are playing a role in the fertility space and in terms of achieving a pregnancy. But it's overlooked because men have an infinite amount of sperm, if you will, right? We're not born with X number of sperm. We're making new sperm every day. And so there really is a educational component that plays a role here.
Absolutely. And do male sperm degrade in a certain way? You know, we talk about the females' eggs not being as viable as they, get past age 35.
Yeah.
We've talked about certain lifestyle factors like diet and exercise that may play a role. But what about like stress and environmental factors like toxins? And do they degrade the quality of the sperm?
Absolutely. All of those play a role in a very multifactorial manner, right? So the diet lifestyle plays a role in testosterone. If your testosterone is really low, sperm quality is going to be pretty bad and the sperm counts could be low, right? Toxins play a huge role, right? One of the most important exposures I tell patients is, have you been in a hot tub, a sauna, or a steam room in the past 3 months? Heat exposure to the testicle plays a huge role in sperm production. That's why the testicles are outside of the body. They're kept 2 degrees cooler than core body temperature, right? And even a single exposure for some men can disrupt sperm production for 3 months. Why 3 months? A fresh cycle of sperm is about 72 to 74 days. So I'm not saying everybody who goes in a jacuzzi or a hot tub is going to be infertile, but some men are affected, right? So a wet heat exposure plays a role in fertility. Other toxins, right? Some of the most common cancers in young men, testicular cancer, both from the testicle being removed and the cancer itself, but if they had chemotherapy, many of the chemotherapy agents cross the blood testis barrier, right? They can impact the germ cells of the testicle. Leukemia, lymphoma, especially some of these guys are prepubescent when they had these diagnoses, or they're in their teens, right? They've been exposed to these harmful toxins and chemicals. They've had radiation for cancer, scattered radiation in the testicle. All this can disrupt sperm production, sperm quality. And I think that's when kind of like fertility preservation comes in, which is a whole separate thing. But yeah, there's a lot of things that can impact the quality of sperm, and those are kind of just to name a few.
Wow, you just mentioned fertility preservation, and now I'm very interested. What is that exactly, and what does that entail? How can they preserve their fertility?
So it's this a fertility preservation is a really well established part of cancer treatment nowadays by the ASCO guidelines. Men who are interested in fertility prior to cancer treatment should undergo fertility preservation. That most commonly includes things like freezing sperm, giving a sample and having it frozen prior to the commencement of any cancer treatment, whether we're removing the testicle for cancer, whether you're getting chemotherapy, radiation, a bone marrow transplant, whole body irradiation. Freezing your sperm for men and freezing eggs for women now is an important part of cancer treatment. Sometimes, right, due to the cancer, as you mentioned, there's stress, hormonal stress on the body. Men can be sick, right? They could be immunosuppressed. Sperm counts are low when you have a cancer diagnosis. Up to 30% of men can have lower sperm counts, and 10% of men with testicular cancer have zero sperm. So, what does that man do? He goes to free sperm, and then the lab tells him there's no sperm here. But what are his options? That's when we kind of get into the more detail. That's kind of when my oncology colleagues will kind of call me and say like, hey, we're starting chemotherapy. He wants to bank sperm and freeze his sperm. There's no sperm. What are the options available? So something we can employ is a sperm extraction that could be done at the time of the testicle being removed if it's a testicular cancer, or if the patient has leukemia, for example, and is undergoing systemic therapy. We'll take the patient in the operating room under light sedation, open the testicle, and we could find sperm in the testicle that's not able to come out of the ejaculate. It's low numbers, so it's sometimes we can't find it in the testicle. Has its own kind of associated success rates. It could be anywhere from 30 to 50%. So sperm extraction is a procedure. Other things that prevent men from banking sperm, right? Like some men with spinal cord injuries, they suffered a fall, they had a car accident. These men can ejaculate. They are anejaculatory. They may or may not have an erection, but there's no ejaculate. And so there are male vibrators, penile vibratory stimulation. We can medically vibrate the penis to induce ejaculation so we could freeze that sample. So outside of the go to a cryobank and free sperm, I mean, I think that's like 80 to 90% of the time, but there are instances, other barriers at play that where a fertility specialist comes into play.
Yes, and you're mentioning the inability to have an erection. So let's go into that a little bit. What are some of the main reasons why men are unable to have an erection?
So let's think first about what makes a good erection. Like, what is the process of an erection, right? So it is a passive process. So you need to get good blood flow to the penis. As the penis fills with blood, the smooth muscle of the penis expands. These are the corporal bodies. And it compresses the veins around the penis so you don't lose that blood, right? So blood flow into the penis, ability to maintain that blood so you don't have things like venous leak. The hormonal environment, if you will, needs to be normal, like normal testosterone, right? Low testosterone. Erectile dysfunction is an important symptom of low testosterone. So I say the hormonal environment needs to be important. The nerves important for erections have to be normal, right? So poorly controlled diabetes. If you've had a pelvic surgery in the past, whether that was your prostate was removed, you had colon cancer and they did a low anterior resection and the rectum was removed, all the nerves for the pelvis and penis are in that space. So the nerves need to be important, right? Those need to be at play. So all those need to be at play in addition to the mindset, which is one of the most important things, right? Psychogenic, or what I like to call confidence-based erectile dysfunction, plays a huge role. If everything is totally normal, but you're depressed, you're stressed, you're super anxious, new partner, all of that will result in erectile dysfunction. So it really takes the whole history to kind of understand what's the likely culprit. Like, you're actually really anxious, and that's why you can't get a good erection. And the good news is, I give men Cialis, low dose daily, boost their confidence, to get good blood flow to the penis.
Or go to a therapist.
And they realize that they don't need to take these medications after 3 months and everything is totally normal, right? As you mentioned, sexual health therapy plays a huge role. I think it's highly underutilized. I mean, guys just want to take a pill, and sometimes and they want their testosterone to go be through the roof. And I tell them, your testosterone's normal, and there's nothing medically wrong. You're just stressed and anxious. You should see a therapist. No, no, but like I heard my testosterone should be 1,000. I mean,
Yes.
stuff I
Oh,
hear.
I deal with this all the time, especially for people who really want to lose weight, want to improve their health. They really want just that magic pill to make the problems go away. And you are just making the point for me that there is no magic pill. There are lots of amazing interventions like you are providing. But if all of your numbers are okay, there is absolutely nothing wrong with going to talk to somebody about anxiety. We live in an anxiety producing world and need to find proactive ways to deal with it. And so I think a lot of people have that negative view still, that stigma around mental health. But I think if we can couch it in just building better skills, learning how to handle stress better, finding ways to thrive in your life, maybe we can get more people on board with the mental side of erectile dysfunction. So I'm really glad you mentioned that. Now, I really, 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 really want to get into these AI tools because I think this is super cool. I love new technologies. So, what are these tools being developed and how do they help identify root causes of male infertility or sexual dysfunction?
Yeah, so this is a very kind of new space, especially in the men's health world. There's not a lot of work being done so far. There's a few colleagues around the country and the world who are kind of working in this. And it goes anywhere from using AI to the time of a sperm extraction to help you identify areas that may have sperm for men who have no sperm, to things like using AI to develop patient education materials and the readability of things for patients in the men's health space, to things like predicting after radical prostatectomy for prostate cancer, what is the probability that this patient's erections will be improved naturally, depending on all their kind of cancer history, their lifestyle, their pre-surgery testosterone, all those sorts of things, and to semen testing. So right now, what I'm really focusing on with one of my colleagues, Dr. Gio Cacciamani, who is the kind of director of the AI Center in Urology at USC, we're working to build patient education materials in the fertility and men's sexual health space for patients that we're trying to show is much more improved than the ones from our urologic societies. I mean, the American Urologic Association, different societies have, hey, read this if you want to have a vasectomy, or if you want to have a vasectomy reversal, or if you want to have a penile prosthesis. And we're learning that a lot of these patient education materials don't do a great job explaining it to patient in a way that's readable, understandable, right? And that's ultimately like that's we're first signing up a patient for surgery and we're giving them things to read about. And if they can't understand it because the accessibility is poor, I mean, we need to do a better job at that. So we're looking at ways to use AI to develop up to date, not even just improve readability and accessibility and understandability, but a lot of these things are outdated. They're referring to guidelines and studies from 7 years ago, and we have new guidelines, but we're not updating the patient side of things. So we're developing it using AI platforms that patients can say, this is much better. I understand this more. This is up to date, and it's much more effective, right? And I'm working on that space with him. And at the same time, we're trying to integrate AI within our men's health clinic. We are process of obtaining and studying a direct to consumer semen analysis. So in office, tiny little machine, patient provides a semen sample with a single drop of the semen sample within 15 minutes, we can obtain those results. Rather than the traditional way, you come in and see me, I tell you what you need to do, you go do your homework, if you will, right? Go to the lab, make an appointment to do a semen test, do another semen test because we recommend two, come back a month later. This way, they come in on the day of the appointment, semen sample, I get the results within 10 minutes. I could immediately tell them using this AI technology These are your numbers. This is where things stand. This is what we need to do. This is what you need to optimize if we can. So
Wow.
we're trying to integrate it from those standpoints.
Is there any movement towards using AI in surgery at all? Do you see anything in that realm?
Not really from the men's health, like the implant Peyronie space just yet within surgery. There are some groups that was at the meeting at the American Society of Reproductive Medicine last year from Turkey, I believe, and China, looking at using a microscope at the time of a sperm extraction, but identifying areas. It's like an AI form of a microscope that could tell you based on the human eye, but an AI availability, this area may be more likely to harbor sperm. You should target this area rather than what we kind of do now using a microscope to look for tubules that are more full compared to others. The data there is not really strong yet. It's really a work in progress, especially from the fertility and men's health side. But those are kind of things that within surgery I've seen being implemented.
That is so cool. I think a lot of people are really afraid of AI taking over the world, but I think if we utilize it in a way that speeds things up for us, helps us, makes things more understandable, helps with diagnostics. I mean, come on, you guys,
Yeah.
let's speed up here and let's get this. Now, you just mentioned something that I actually don't understand. What is Peyronie's disease? And what are the treatment options available for men dealing with this?
Sure. So Peyronie's disease is a scar tissue buildup or plaque buildup of the penis. We don't really understand why it occurs for many men. So some men have had trauma to the penis that they could recall. The majority of men don't remember that. Maybe they had an awkward sexual position resulted in a bend of the penis, and you could have a fracture or a
Yeah.
breaking of the strong sheath of the penis that surrounds the corporal bodies. That can result in erectile dysfunction, and that can result in scarring at that area, causing curvature and or deformity, right? So many times men don't recall anything, and they start to notice that their penis starts to be more curved, typically at the ages of 50 or so. We think it has to do with repetitive micro trauma, meaning especially men who may have some ED, there's some micro bending of the penis with intimacy, and maybe there's a genetic component to it. But plaque builds up typically on the top side of the penis. It's not cancer, it's not dangerous, but men could feel like a hard nodule there. Sometimes it could be calcified, feels like literally like a rock in the middle of their penis. And when the penis stretches if they have a good erection, that can cause a bending up of the penis. It can bend to the side. There's other deformities where the penis can be out, and then it kind of hourglasses, and then it comes out, causes a deformity like that. Men report length loss of the penis because the corporal bodies can't stretch as much. And so the penis feels shorter and skinnier, right? So really different kinds of deformities. It's not just a curve. I think that's kind of the misconception. Treatment options are really based on functionality, right? So if you have a little bit of a curvature, it's not causing an inability to penetrate. You could still have sex. You can make do with it. We don't have to do anything about it, right? We just keep an eye on it. If it gets worse, then we could focus on treatment for functionality. Meaning the take home is like, we're not working to get you an arrow straight penis again. We're trying to improve it so you can improve your sexual quality of life. And if that prevents you from having intercourse, then we want to get you to be able to do that. So from least invasive to most invasive. Most men don't want a lot of invasive things done to their penis, right? You don't want penis is your best friend. You want to take good care of them, right? And so the least invasive thing, there are stretching devices. There are stretching devices for the penis to stretch the penis straight and opposite the curvature. And that's been shown to, if you apply it daily for 30, 60 minutes a day for the next 3 to 6 months, the penis could gain length as well as straighten. Typically recommend a device, no prescription required. It's called RestoreX. You could purchase it online. It was developed by a colleague, Landon Trost, who was at the Mayo Clinic at the time. He's a really brilliant mind in the men's health world. So that works well. I tell patients about that all the time. Then we go on to injections. We can inject the scar tissue of the penis with a medicine known as a collagenase, or Xiaflex is the brand name. Xiaflex is the only kind of FDA-approved medication that we inject to soften the plaque, and that can help improve the curvature about 30%, right? So if your curvature is, we measure it, if it's 60 degrees, the goal is to get you down to kind of 30 and it's functional and it's okay. So Xiaflex is an option. I tell guys when we treat the Peyronies, you got to give up something, right? Are you going to give up your time? Like Xiaflex can take 6 months for the whole process. It's a series of injections over a 6 to 8 month period, right? And then we're moving over to surgery, right? We could do a quick surgery. I could straighten the penis, known as a plication. Works best if the curvature is kind of mild. Men have a long penis. Why? Because when we plicate the penis, you can lose a little bit of length. So if you don't mind losing a touch of length, straighten the penis, one and done surgery, takes about an hour, you're good to go. Great option. If you're worried about length loss in general, you don't want to have surgery, not a good option. And then finally, this is the most kind of invasive options. We can surgically remove the scar, right? Basically open the penis, remove the scar, suture in a graft to take up that space. But that can cause erectile dysfunction. So you really need to be an excellent candidate for that surgery. Who is a candidate for that surgery? Men who have really severe deformity, like severe curvature, like 90-degree curvature. The penis is bending back on itself, right? Xiaflex is not going to fix that. A stretching device is unlikely to make that functional. And you need to have good erections, right? Because that surgery makes erectile dysfunction a little bit more common. Most of the time, if these are men who are older, 65, they also have bad ED, they have curvature. We'll do just a complete reconstruction, which we'll do a penile prosthesis and straightening at the same time, right? So we'll do a mechanical device for the erections. We'll straighten the penis at the same time. And the end result is a totally straight penis that can get hard with mechanical pumping. And men are super happy with that procedure. I'm doing a couple this week. It's like one of my favorite operations because men are incredibly happy. And if they're a good candidate for that surgery, they have bad ED anyways, the penis is super curved and deformed. This is the best sort of ultimate definitive surgical reconstruction.
Wow, there are so many ways. And I think you're giving some guys out there a couple ideas about how to increase their length without going to surgery. So, wow, that's amazing. There's so many options out there. It's incredible.
Yeah.
Now, I really want to know about my dad has prostate cancer. He's managing it, and he had the prostate actually removed. But that leads, of course, to sexual dysfunction and different other difficulties. So, how do you counsel and treat men who experience sexual dysfunction because of prostate cancer treatment, especially those who really want to regain some intimacy?
Yeah. So, at USC, we do a prehab and post prostatectomy penile rehab protocol. So I like to be very aggressive for men who want to be about optimizing their penile health before and after surgery, right? So predictors of what sexual function will look like after surgery, we want to look at what's your erections before surgery. Are they perfect? Do you have some baseline ED, right? What type of prostate cancer do you have? Is your surgeon, can they successfully and safely perform a kind of bilateral nerve sparing approach, meaning we preserve completely the nerves for erections. But even with those techniques, right, there's stretching of the nerves that results that can cause issues with erection. So I put men on medication. Low dose Cialis 5 daily has been shown to improve erections after prostatectomy. I'll start that before surgery. We'll start that after surgery. And I see men pretty closely in the office. So at about 2 to 3 months after surgery, see what their erectile function is like, and we slowly escalate things from there. If men want to be aggressive about maximizing their penile health, I'm right there with them. Some men are older, they don't really care, want to let it go by the wayside. I just counsel them appropriately. But I think the other side of things that plays a huge role in sexual function is the incontinence, right? Apopectomy incontinence is very common, and it can take 3 to 6 months for men to achieve continence. Right. And so if you're leaking urine, it's hard to get you a good erection and be intimate. It's not very sexy when you're leaking urine. So even men who regain their continence can suffer from climacturia, right? When they orgasm, the pelvic muscles relax and they could leak urine, right? These all play a role in sexual function. So usually the guys who are 3 months out are not really thinking about their erections. They just don't want to leak anymore, don't want to be in a diaper and a pad. So While we try to manage them concurrently, it's super common, it's super normal. Men want to get dry first before they treat the erection. So we just take it with that, keep them on the Cialis, get the blood flow going to the penis, have them booster dose with Viagra a couple times a week as well to kind of maximize blood flow to the penis. But usually as early as 3 to 6 months, if the erections are not satisfactory with the medication and the bilateral nerve sparing approach, I'll get men on injections. We'll start injecting. We want to maximize the health of the penis. How do we do that? Get a good erection, right? So I'll have men inject the penis with medication to stretch the penis, do that 2 to 3 times a week. That could help improve natural erectile recovery.
Wow. And just real quick, I mean, this is something that my dad had gone through, the incontinence. How do you treat that?
Yeah. The majority of men will regain continence, is the good news, with time and pelvic floor physical therapy. So we send men to see a pelvic floor physical therapy expert at USC, Kegel exercises, pelvic muscle training. 60% of men will be dry at about 6 months. Some men are even dry at 3 months. The good news is at 12 months, 90% of men will be dry. That's a 12-month period for some men, but almost all men will be dry at 12 months. If it is an ongoing issue, and some men do have persistent severe incontinence, maybe they also had radiation after prostatectomy, things like that can make recovery really difficult. There are a lot of treatment options. So there's prosthetic surgery, prosthetic sphincters, which I do, known as an AUS, artificial urinary sphincter, where we surgically implant a prosthetic device that will keep the urethra closed to prevent you from leaking. That's kind of the gold standard. There's other options like male slings. So just like in women who may leak after having children, there are slings for men, but they're usually reserved for men with really mild incontinence. Not a candidate if you've had radiation or you have a lot of leakage, like you're wearing 5-6 pads a day. It's not going to help that much. And there's some new kind of continence balloons that are adjustable continence balloons that we have experts at USC who can do that work well for the moderate incontinence space as well. So there's really a lot of options. Unfortunately, they're surgical options. They're not a medicine that we can give you to help improve stress incontinence.
Wow. Well, I got to get my dad from Colorado to California to come and see you for sure. And speaking of that, since we're low on time, can you please tell people how they can come and work with you? Because you are a wealth of knowledge. You are at the cutting edge of these treatments, and I think men are going to be calling you soon. So how do they get a hold of you?
Sure. Yeah. So I'm really fortunate to be part of the USC faculty and department. I do have a few locations. I'm in the Beverly Hills office every week. I'm in Santa Clarita actually today, and I have an office here seeing patients in the Valencia area as well as the main hospital. So really reach out to USC, 1-800-USC-CARE. They can set an appointment to see me. Happy to see you either in any location that works. Either that's in person, we could do a video call, or a telemedicine visit as well to start things off if you're coming from far, and then get you in for an exam if we need to do that as well. So it'd be a pleasure to take care of you.
Yay. And all that will be in the show notes. You guys, I really encourage you to reach out to Dr. Kian if you are experiencing any of these problems. And, if you are, and they might be some lifestyle factors, we've given you a lot of directions that you can go in to help improve your sexual health and your cardiac health as well, general health as well. So please take those seriously. If it is a psychological thing, there is no shame in that. We live in an anxiety-producing world, and there are plenty of therapists out there, myself included, who would be happy to help to restore your sexual health if it's a psychological problem. So thank you so much for coming on the podcast, Dr. Kian. I really appreciate you spending this time with me.
Thank you. Thank you for having me. It's been such a nice hour to hang out.
Definitely. And thank you everyone for tuning in. I am really looking forward for our next exciting interview, and I will see you next time.
Thanks for tuning into the A New Insight podcast. Please remember, the contents shared on this podcast is for entertainment purposes only and does not constitute medical advice. You can find us anywhere podcasts are streaming. on YouTube at my.anu.insight and at anu-insight.com under the Anu Insight Podcast tab. And follow us on our socials at my.anu.insight on Facebook, Instagram, TikTok, and Threads for more updates. Tune in next time and evolve with us.